Welcome to Because We Love You. We are so excited to be here today once again with Dr. Metheney. I've worked with her for 13 years. She's been stuck with me. I've learned so much from her, and she's been a great partner in crime. No, we're not doing anything criminal here. I would never do anything criminal. But she's been great support, and I'm so glad to be under her preceptorship, even though we work together. I don't know. But we are, so I'm excited for her to be here. We actually both went to the same school, just for different degrees. She got her medical doctorate, and I got my physician assistant training. And so we are going to talk about something today that I know is intriguing to all women and men alike. There are men who are in, who this sparks something when they hear, how can I lose 10 pounds? Weight. Weight is a huge issue in today's society. And it's also, we know it's huge in the medical world. We know that obesity is one of the risk factors for many diseases, cancers. We know that breast cancer and obesity are very tightly linked. And so it's an important thing to talk about. But we're talking about it in light of some... of a drug, a miracle fat loss drug, the GLP-1s, the injections, the pills. And so I wanted to talk to Dr. Metheney about what are your thoughts on weight loss via these injections?
Gotcha. Well, so they serve a role. Always we really encourage people to get as healthy as they can be at a weight that feels good to them and feels healthy and strong, and try to provide some tools to help people do that before we get to that medicine conversation. But when we get to the medicine conversation, GLP-1s are the most powerful weight loss agents currently on the market. They're incredibly expensive. Because they are newer, and they do work. They do.
To put in perspective, I did look at this statistic. It's 16% of your body weight in 6 months is the average.
Gotcha.
So what is the most you've ever seen a patient lose in 1 month?
Oh, in a month? I'd say on a GLP-1, probably about 16 pounds.
Oh,
but
I've seen 30.
I'd say it's a little, the one thing I typically see is it tends to be more steady. I don't see quite the huge drop in the beginning and then it kind of peters off like a lot of weight loss drugs. What I see is a little bit more consistent, but I think 16 is probably the most I've seen in 1 month. So you had somebody who clearly was doing some other things besides just their medicine.
I don't think they were eating.
They were
at
probably
all.
very motivated.
But they did have a lot to lose. So that also will affect how much you lose monthly. Is if you have a lot to lose, then it can be pretty drastic those first few months. But I'm sure you've seen people lose even over 100 pounds on their journey, which is unheard of previously with medication. We would see that with gastric bypass or gastric sleeve, but not with medication. So this is that's shocking.
Yeah. But I think they're just like, again, all medications, there's good and bad. I think they do get touted as just these wonderful and amazing drugs, and there are wonderful things about them. But there are some negative things, and I think that's where it has to be a very informed decision to go on these medicines and really understanding kind of what you're signing up for. So for example, GI issues is probably one of the biggest concerns with these medicines. I would tell you probably 90% of my patients get nauseated with these medicines. It might be the whole, every day that they're on it. It might just be a couple of, if they're on a weekly injection, for example, it might just be a couple of days after the injection. But most of them do experience that. Constipation is huge. Diarrhea can actually happen on these drugs too, but I feel like constipation is what I mostly encounter with my patients. We have to have lots of discussions about how to manage that on a regular basis with these drugs. Abdominal pain. I have had a few people where we've just had to stop it because they had just pain and just we'd stop it and restart it and they'd start hurting again, and clearly it was the medicine and we just couldn't use the medicines. And there's some bigger risks like pancreatitis. And so that can be life-threatening. People can end up in the hospital with that. It is more rare, but it is a real thing. And I have seen it happen several times. Gallbladder issues, gallbladder disease. And one that even I didn't hear a whole lot about a couple years ago, but I'm hearing a lot more about is the retinopathy issues. So definitely if there's somebody that's interested and they have eye issues, talk to your eye doctor first. Make sure that they think that you're an okay candidate for this drug. So again, rare, but very serious if you lose your vision permanently in your eye. So
especially, and I think this is important to know, especially when you're taking these drugs for just weight loss. These drugs, most people probably know this, they came about as a diabetic medication.
Yeah.
So sometimes whenever we're prescribing them, these are things that are actually getting patients A1Cs to goal, their sugars, and it's very important, and it's been it's a useful tool. But I think, when you talk about risk versus benefits, that changes when it's to lose 10 or 15 pounds, 100 pounds, or these side effects, or diabetics, which the risks are much greater for those people if they're not able to get their A1Cs. So absolutely. I think does that play a role, like in when you think of the GLP class of medicines, like how much you love them or hate them kind of thing?
I mean, for me, it's always risk versus benefit. Always, always, always. Are we going to take on risk for 10 pounds versus you have some major medical conditions, which maybe we can make better if we lose that 80, 90, 100 pounds. And so I think each time and each patient, that should be weighed out, that risk and benefit. And then just having a really intense conversation about what the medication can do or side effects, so that person's very educated, they're monitoring, they know what's going on, they reach out immediately if they see concerns. But and this is why I think it's so important that if you are going down the path of taking one of these drugs, you need to work with your provider. This is what makes me nervous about a lot of these online things where you just fill out a form and then you pay your $400 and then you just get your medicine in the mail. These are serious drugs. And, part of it is, we don't always know when a drug goes on the market, what's going to happen in 10, 15, and 20 years. It might get pulled from the market. And so I think working with your provider very closely with these drugs and really monitoring them is so important.
Exactly. Yeah. So we know, I think benefits are clear. The weight loss is amazing. And weight loss, we know that obesity is associated. So if we get our weight down, then we're going to decrease some cancer risk, which could be beneficial. There is some news. Speak to the cardiovascular data.
Yeah. So there is some newer data out there about reducing risk for cardiovascular disease, heart attacks, things like that. And part of that is probably that direct relationship of losing. So we know that if you carry weight in the middle,
which I do. If I was naked right now, you'd be like, she carries it in the middle. No, I got tiny extremities and a big old gut.
But we know people where if that's where they put their weight, guess what? They're at increased risk. Yeah. Some people put it on their thighs and their hips. That doesn't seem to be related to cardiovascular disease.
I'm a bird.
So and so if you reduce that abdominal fat, it does statistically reduce risk for cardiovascular disease. So it makes sense that in the studies, it did prove out that is effective. There's some data for chronic kidney disease as well. Again, some data out there, and even really, I think a new FDA-approved indication for one of the GLP-1s, particularly for sleep apnea. Again, primarily sleep apnea with obesity. Not everybody who has sleep apnea is overweight. Some of them are sticks, I promise you. And they have severe sleep apnea. That person is probably not going to benefit from being on a GLP-1 to help treat their sleep apnea.
So we know those benefits. What are some unique concerns? Because, so you gave kind of like the list, and we've talked about this like off camera quite a bit, and some things that we don't that we perceive could be problems long term.
Yeah. So one of the big issues, and there are some articles and studies that have been coming out more recently as these drugs have really gained momentum over the last couple of years, is the muscle mass is huge. And so so your body is not going to discriminate. When it's going to burn calories, for you to lose weight, you're going to burn fat, but you're going to lose muscle. It's going to break it down from different places in your body. And the only way to deter that is to exercise, and particularly resistance training, weight training, which really need to be doing 2 to 3 times a week on these drugs. Otherwise, you'll lose weight, but you're going to lose muscle mass. If you're losing muscle mass, then you are probably losing bone mass. If that resistance training, again, can help combat that, it can kind of tell your body, hey, select for the fat. I need my muscles, right? Because I'm working them out. I'm using them. That actually helps keep your bones strong. We know that is one of the integral treatments for osteoporosis and osteopenia is resistance training. And so the keys for that is, number one, giving your body the building blocks to keep your muscle mass in place, and that's protein. So it's really important to get adequate protein intake on these drugs. And the other is
how many grams a day do you usually suggest?
I think 80.
I say 60 to 80.
60 to 80. Okay.
Yeah.
Okay.
I mean, it's kind of hard to get that. So I like to be realistic, because if you spout off some beautiful protein goal to people and your patients, and they're not going to follow them, and then they see how dramatic that is. So I'm like, even if you can just get 20 grams every meal that you eat, that would be beautiful for.
And a lot of times, honestly, I just focus on making it simple. Like, get a protein with every meal. And if you eat a snack, make it a protein snack. So if it's a cheese stick, if it's a nut butter without a whole bunch of sugar in it, if it's a cup of Greek yogurt, which tends to be low in sugar and high in protein, if it's a meat, that's fine. But just remember, you can get a lot of protein from plant-based products as well. If it's lentils, if it's, you can get really creative. If it's, just finding things, trying some different things that you like, and then being able to incorporate that hard-boiled egg, can add that to your breakfast. So it's just, you have to be thoughtful about it. And really, when you're trying to lose weight, that's really one of the things they strongly encourage is meal planning. So that you're not running on the go or grabbing something or not having that protein that you needed because you don't have it available. So pre-planning what you're going to eat for the week or a couple of days ahead, so that way it's accessible, it's easier, it's something you like,
Yeah, exactly. But I do think that is something we're going to really see, because, how many years have we really been prescribing these medicines? About, I guess like 5 to 6. Well, but it was a little bit before. There were some drugs, but they were
for diabetes.
Yes, for diabetes.
Powerful, so that went out a little bit.
And they were harder because they were daily injections, and so people weren't really fans of these. So it's really come a long way, but we still don't have that long-term data. And I do think that we are going to see an influx of osteoporosis and fractures and fall risk and balance, and some things that with this rapid weight loss, because we'll see people lose 100 pounds in a year. Well, I'm seeing a lot of even like cardiovascular, something we call orthostatic hypotension, where their body's just not regulating when they change positions. Their blood pressure's dropping when they stand, and so that's increasing their fall risk.
Hypoglycemia.
Yes.
I've seen that in quite a few, and that's part of what these drugs, again, were designed for. They were designed to reduce blood sugar levels. And so even in people who don't have diabetes, some of the ones that I've seen that have been on it more long-term and lost lots of weight, they're starting to have hypoglycemia even when they eat. So it's a real thing. I mean,
I wanted to do this episode because we do prescribe. I do prescribe. I know you prescribe. It's a lot, and I do believe in them. And there are some patients that it has been life-changing in the positive way. Like, it has been so beneficial. Because we know that when we feel a little bit better about ourselves, depression tends to decrease, and anxiety, and we feel more confident, and we tend to start doing more. So, we see all these benefits, but we just want people to know that, there's always other things to be thinking about. And so, when we think about these, is there anything that you would want people to know, no matter what, when they are considering going on weight loss drugs?
Yeah. So I think a couple of things. One is that you still are going to have to really be purposeful and put some work in. And what I mean by that is that this is a tool and it's an aid. And so just understanding that going in, you're still going to have to be very purposeful about food planning and what you're eating. Sometimes it can make you not want to eat at all. And so it's important to get that nourishment and nutrition in and make sure that what you are putting in is healthy. So you're still going to have to plan. You're still going to have to food prep. You're still going to have to get to the gym. You're going to have to do resistance training. And that has to be part of the regimen of using these drugs. And so if you go in thinking, oh, I'm just going to take this, my friend down the street took it and they look fabulous and they didn't even do anything, please don't approach it that way, because that is when you are going to see the consequences and you're going to have the ill effects of not incorporating all those other important pieces to keep you healthy as you're using this tool. I think the second thing is just understanding too that a lot of the data is showing that this is more of a chronic therapy. Like this is not short term and then come off. We know and we've seen it. People use it for a period of time and come off and they gain weight back. And then 6 months later, a year later, I think I want to get back on that medicine again. And they are realizing that it is more effective if it's used long term. And so I think understanding that if you go down this route, am I willing to do this for a year and 2 years and 5 years and maybe 10 years? And so thinking about that piece of it.
And the cost.
If
that's involved, and insurance doesn't always pay for it, and they may stop the next year.
Yes.
Even if they do pay for it this year.
And it's true. And that's really tough when somebody is doing really well and they're successful and then all of a sudden they're not allowed to happen anymore. And then the other thing, which I know we mentioned earlier, but I still just think it's so important to work with your provider very closely on these drugs. Like I really, really do. Because we've seen the good and the bad. And I think mostly what's online is the good. And so just having a provider who's invested in your health as well to help guide you through this process of this medication and being savvy and being on the lookout for things that, could be that effects of these drugs.
Yeah. And just keeping you accountable. I know that sometimes people don't really love that, like that we want to see you in 3 months. We want to see you in in this increment, but it is to like make sure that you are doing those things and really push. I don't want to scare them, but I definitely want them to be well. I don't want them to show up or end up in the hospital one day and be like, I had no clue.
Right.
I had no clue what I was putting into my body. I had no clue it could do this. And that's what's kind of shocking about even the legal actions that's taking place. It was like, these are all things that we knew.
Yeah.
We knew about this, and that you're assuming that risk. And we didn't, you talked about GI side effects, we've definitely seen a lot of permanent stomach paralysis, which is gastroparesis. Now, granted, it was with patients who were at high doses for diabetes for a long time. Like I've not seen one personally in my patient profile for weight only. But that's it's devastating for those patients, for that patient, and it changes your whole life, because life without a stomach is miserable. Yeah.
Absolutely.
So is that worth it? That's why you need to be open in that conversation with people.
You do. And there are some great, if somebody's interested in non-medicine options, we have great programs. I know here in our local area with board certified physicians and practice providers who have certifications and certificates for weight loss medicine that are experienced. And I'm sure wherever your local area is, I'm sure they have programs as well. Some of them are very personalized, and some of them can even incorporate a gym workout component along with the education and guidance. And so just know that there are some good options out there. If you say, gosh, I don't know that is the right thing for me, but I still really want to lose weight, and I want to be successful, and I want to feel better.
Yeah. And I think, it's important to know that, like, it always that we're all working at this, that there's very few people that are sitting around doing nothing and look at me, that look like they're a healthy weight and they're like, I do nothing. No, like we're all trying to cut back, because there there is the, just like we talked about perimenopause and menopause last week. Even with men, there's hormonal changes that happen as we age and our metabolism is decreasing. So we're all battling the grind,
Absolutely.
the grind of weight.
Yeah. And I think in America, I mean, that's part of why there's an obesity epidemic in America, right? It's part of our culture. It's part of our lifestyle. We drive everywhere. Fast food is so accessible. It's cheap. It tastes good. We lead these crazy
Dopamine
lives.
dump. I call it the dopamine dump. I was like, I just want my dopamine dump.
Yes. And we're all running around like crazy. We're doing this and that and running here and there. And the day starts at, 6 and then we're going to bed at 11 and we're not giving ourselves enough sleep. And we know going back to sleep, lack of sleep, increases your risk for developing obesity.
Yes.
And because they're very much tied together, there's a lot of chemicals and hormones that play roles together in the body that can directly affect that. And so a lot of it is just how we live our lives and our culture. And we've done an amazing job in our food industry of making food that's not good for us taste really good. It's an industry. Yeah. It is part of the food industry. And so realizing that and trying to get back to healthier options and getting your taste buds to change a little bit and realize that like, oh, this is good too. I'm just not used to it, but boy, those Doritos are good.
Yes. It's hard. It is hard even for us. She is very good a lot of times. She does have a candy drawer that I don't have though.
I do kind of have a chocolate thing.
Just to close, what is a healthy weight for most people? Do you go based on BMI or what do you, if somebody were to come into the clinic, when do you say, hey, you really do need to work on weight?
So for me, I don't focus on BMI as much as I do how the person is feeling. If they're coming in saying, I've got joint pain, I feel tired all the time. If I'm seeing, I'm diagnosing medical conditions. Hey, you're now pre-diabetic. Like for me, that's when I start really having that conversation of how your weight is tied to these things. And most people know that. I'm not telling them anything they don't know, but it opens up the conversation for maybe what they've tried in the past or where they've struggled or where they want to be. And then how can we help you get there? Because I do think it can vary a little bit for what people feel good. And that's the other point. Do you feel good in the body that you're in? If you're based on your BMI, you're carrying an extra 20 pounds, but you say, you know what, I feel good and I'm active. Great. I'm not worried about it. But if you're coming in telling me I don't feel good, then, and I, see that could be one of the contributing factors, then, we try to have a conversation about it. Or sometimes patients come in and they bring it up. They say, you know what, I really want to talk to you about this because I'm really kind of unhappy with where I'm at.
Exactly. That's good. So that's good. But it is a journey and it does take work. Yeah. So, but most good things take a little bit of work.
Yes, they do.
And so I hope that she has inspired you because she's inspired me. I'm like, I've got to be better too. My husband has to be better too. He's sitting off screen right now. And I'm like, we have to be better. We cannot just chase after fast pleasures, that we need to be thinking more and modeling this for our children and the next generation and let it, I mean, we all want to have that piece of cake sometimes or those delicious treats, but letting them be treats for what they are and not a lifestyle. So we hope we do all of this. I do all of this in the after hours. I drug her out here after a long, hard day because we love you.